And I'm back. Aloha again. It's been a while. Um, I am again the traveling doctor, NYU med school trained, Cedars-Sinai residency, internal medicine trained, and a hospitalist again for the last 14 years. And it has been 4 days since my last COVID-19 podcast. Kind of feel like I'm in confessional right now, but thanks again for all you guys who are joining me again. I gave a little bit of update on Tuesday about what the hospital's like. I just about 4 days in the hospital, and while I can't go into a lot of specifics about my hospital, I can tell you generally about what people have been seeing, what I've been seeing. Oh, hey Grace, what's up? Aloha. And generally what the status is of COVID-19 and everything. So how was your guys' week? Anything interesting happen? A lot has happened, I'm sure. For me, it is day number 15. That's 1-5 of self-isolating, social distancing. It's been about 6 days since I was tested negative again for COVID-19, and I did get that test. For a lot of the reasons that I won't go into for my last podcast. So quickly again, a lot more people are getting tested now. And as you all understand and you know about the COVID-19 testing, you're starting to hear there's a lot of false negatives. Again, there's a 80% sensitivity rate. So there's a lot of false negatives again. I'm hearing that the test times are doing a little bit, are going a little quicker, about 2 to 3 days. I've even turnaround in my hospital is getting down to 1 to 2 days. There's starting to be in-state tests done at diagnostic lab services as opposed to Quest, which is another lab that's out on the mainland, and it took like 5 or 6 days. So a lot more people are trying to get these tests, and they're getting them quicker. If you heard from the news, the FDA is approving, or has approved already, a much quicker test that's supposed to take 15 minutes. That's great they approved it. I'm wondering, again, how sensitive this test is and whether it's accurate. And number two, how soon the hospitals are going to get access to this and start testing people. Because if they can really get this test in each of our labs and test people straight out of the ER, that would be great. And the ER around the country are doing some very smart things. They're social distancing or medically distancing all the people who come in for COVID symptoms in respiratory areas outside the actual hospital sometimes, like in waiting rooms that are outside. They don't even let them come into the hospital because they may not be sick. And as I mentioned, if they aren't sick, they may get sick, or if they are sick, they'll give it to everyone else in the hospital. So we'd rather not that happen. As a lot of you are seeing, there's a lot of Brian Oahu, I already talked about, it's 15 minutes, not 5 minutes, and nobody has this yet, as far as I can tell. So originally, the original test was, again, that nasal pharyngeal swab all the way up the nose, and only get that if you tested flu negative. If you tested flu negative, they would send off for that, and again, it took up to a week. I have a friend who got an oral pharyngeal test, a different one, that involves swishing and like spitting out, and he hasn't gotten these results, and it's almost been a week. He's expecting them sometime Sunday or Monday, and he's very high risk, I think. I personally think he potentially has it. Okay. Hey, Tracy, what's up? Hey, Grace. Welcome to Grace's family. So again, one of my, concerns with both the oral test and this new, supposedly fast 15-minute test, and all the home tests I talked about last time, the COVID and Everlywell tests, those are all, I'm worried about their sensitivity and if they're accurate. Obviously, these are all things that we need to come through because we didn't even know about the sensitivity for the original test for a while. So we will see. Brian, I already mentioned about that Abbott test, but again, I'm not really sure how soon everyone will get access to that. Hopefully they do. Eldora, I finished 4 days of work. I'm off of work actually for the next 14 weeks. So anyway, as I mentioned on the last test, I really want to go over the antibody test. And my brother is joining me and trolling me too. That's great, from Louisiana. So the antibody test is very important. Everyone's like, well, am I positive? Am I negative? This is like even like more of a big deal for people than when it was with HIV. Yeah, so Nicola mentions his friend was tested 9 days ago. So the antibody test, again, just to quickly go over immunology, when you get tested for things like, let's say, chickenpox, or hepatitis or whatever, they can tell you if you're IgM, which is actively you are infected at the very least at some point, either now or in the past, or you're IgG positive. IgM, again, means you had been infected before, or you got exposed to it. If you are no longer actively sick, you would have IgM and IgG. If you're actively infected and potentially still sick, you'd have just IgM but no IgG. If you just had IgG, there's nobody in the world that really has that right now. I don't think anybody in the world should have it. If you're just IgG positive for COVID-19, that means you skipped ahead into the future and you got that vaccine. Because if you didn't have IgM, then you only really would make IgG. This is the test I want, and actually I'll get into it later. But England came through, and they're trying to do this a lot more and ramp it up. So that will give us a lot more information about who can go back to work. Were you infected before? Are you infected now? If you're infected now, can you go back to work? Are you safe to go out? Are you possibly immune? These are all questions no one can ask on the current test, only the antibody test. Brian asked, if my test comes back negative, I'm thinking it's a false negative given that I lost my smell. What do I do then? Brian, it's tough. I mean, you could go back and try to get another test and get a real oropharyngeal test, wait for the antibody test to come back. But again, I guess the real thing is, to Brian, like, what would change for you? If you're wondering if you're positive and you're pretty sure you are, then just treat yourself like you are at that point. It sucks the test is negative a lot of times, false negative, I mean. The way you could do it again, if you got another test, it's very unlikely you would get 2 tests in a row with false negative. I mean, it can happen, obviously, but it would be very, very unlikely. But again, if you assume you're positive, then just do what you would do if you assume you're positive. Quarantine yourself for another 14 days after those symptoms started. That's essentially what I would do, if I couldn't get another test. So let me go into another bunch of advice. Again, everyone, I've mentioned this before, no gym, no markets, no Costco. Stop going to these big stores and restaurants. Obviously, you can't go to the restaurants, but stop lining. I feel really bad now because they're seeing all these, all these like Costco and Walmarts are having like special hours for elderly people, and the elderly people are just packing in there and waiting in these lines again, and they're setting themselves up for disasters. So I think it'd be better for someone to bring this stuff to old people, or that they don't go to those places and go to smaller places like a Safeway, or maybe not a Safeway, but a smaller grocery store. When you wait in lines outside, that defeats the purpose of all of this. Unless you happen to have a 6-foot grocery cart and everyone stays away from you for 6 feet. It's really kind of silly. It's really, really stupid. So again, no gyms, no dates, no church, no obviously community things, a lot of stuff. Brian asks, well, I'm concerned about priority to get into the ER if I get pneumonia. Brian, I mean, very likely, if you were really sick and you had pneumonia, anything short of breath, you obviously should go in and then you have pneumonia, and then they would get the real x-rays. I mean, ideally, this is where telemedicine comes in. You talk to a doctor and they could schedule for an x-ray or an outpatient, other stuff, or even outpatient antibiotics or other testing to get done. Lisa, I'll mention some of this. So Lisa mentioned about the lozenges, and I talked about a lot of these symptomatic meds that I'll go into a little bit later. So again, avoid all that stuff, washing the hands, keep virtual dates, dinners, and all these things with your friends and family. Danielle says, New Zealand government said no senior hours. They don't want to give senior shopping at all. Yeah, that's a great idea. Yeah, Nicholas, save.com ordering. I encourage everyone to order things online. My brother and I are helping our parents order grocery delivery. I mean, yes, it costs money, but if it's for your elderly, parents, you can do it once a week or once every 2 weeks and stock it up. Wash the stuff after you kick the box out. Don't use that, And yeah, seniors, teach them how to use Instacart, like Lisa said. I have no idea how to do that, So that really everyone. Okay, going back to the lozenges. So I talked a little bit of the virus spread, and again, you all know about wiping your hands down, washing for 20 seconds, wiping down all the faucets, everything that's shared use in your house, especially people are going out and shopping and they forget to wash their hands thoroughly, touching refrigerator, cabinets, bars, and all that stuff. Again, crazy statistics. When they got back in dock, and then they tested the room, 17 days later, they found coronavirus in some of those interior staterooms. 17 days, that's 2 weeks later, they were still finding evidence of coronavirus. So you just have to assume that it's around there, maybe as long as you should be quarantining, 14 days. It's almost a race. Wipe everything down and just do that. So going into more of the, as I mentioned a lot before, Tylenol, guaifenesin DM, extended release, or Mucinex DM for coughs, Hall lozenges, okay? Menthol lozenges are super cheap, super cheap, and they do really well for sore throat and for cough. I think the cough is really bad in this disease, from what I've been hearing, and if I had, and it's what I think I'm experiencing, if I had a false negative result, like Brian had mentioned. These is name, but you don't need a cold. You can get general zinc glucose once every like 3. It should be about 6 lozenges, 8 lozenges, but they mess up stuff. Grace, sorry, my alarm went off because I was trying to remember and I forgot to shut off, so that's why my alarm keeps going off. So the zinc lozenges, I want to prepare you. I've been using zinc lozenges for years. I put one in every one of my travel go bags in case I get sick, and a bag of Hall's menthol lozenges. Hall's menthol lozenges and zinc lozenges. What messes you up with the zinc lozenges is they really screw taste. They don't screw up your smell, but they screw up your taste, okay? And the scariest thing, if you do take them, because eventually you'll take them, don't use them right now if you don't need to, because it's hard to get these. Even on order these, and they may take weeks to come, and no Walmart and no, like, you know, pharmacy has these zinc lozenges. I love these things. They're really good for any viral respiratory infection. It's the #1 thing I would recommend everyone have that will really help them feel a little bit better, along with cough drops, honestly. All the other stuff people have been talking about, vitamin C, vitamin D, hydroxychloroquine, I'll go into a little bit later. So here's the thing. If you really want to, it really messes up your taste, and I'll go into the smell stuff, because I know everyone's heard about this smell thing, and they're worried about losing their smell, like my friend Brian has lost his smell, who's a possible COVID-19 patient. So really weird, when you take zinc lozenges, when you drink water, it tastes like milk. It's really weird. It not only has a metallic taste and screws up all your other food, when you drink water, it screws up your taste, and it actually tastes like milk. And it may screw up your taste for a while, but it's not permanent. And as I mentioned to Brian, there's and other friends, there's a theory that COVID-19 affects the nose nerves. Some people know these, but the nose nerves go directly into your brain. They're one neuron directly from your olfactory nervous system, cranial nerve 1 they call it, directly into your brain. And if you screw it up, you can't smell. If you get punched in the face real hard, you shear all those nose things, and you also can't smell for a while. But they usually come back. They usually come back. Okay. So that's all the stuff about the over-the-counter stuff. I've heard anecdotal evidence about vitamin C and vitamin D. I cannot endorse them because I don't see a lot of good evidence for them specifically for COVID-19. It's not to say they'll hurt. They probably won't hurt. So go outside and get a tan, take your vitamin D stuff, take your vitamin C. I just cannot endorse them the same way I would endorse zinc lozenges and just like all lozenges, like that itself. Like, I mean, maybe the vitamin C, vitamin D may have some, or you may just piss it out. There's no way to know right now that it'll definitely provide you protection or getting better from COVID-19. It may help, but there's zero evidence I've seen in a study. If anyone has a that shows it, a legitimate study from a peer-reviewed, journal, then send it to me. I will talk about it on the next article. Stan, yes, I am wearing pants. I can show them later. I'm on pants, okay? I'm trying to be in doctor mood. I can be in doctor mood a lot better when I'm in scrubs. It's for the imaging. It's for the branding, okay? So a bunch of other stuff. I'll go into the masks later. Again, surgical masks, N95s, all this stuff is still hard to find, as everyone knows. The ventilators are hard to find. People are trying to make, their homemade ones. They're trying to make homemade bandanas, homemade ventilators. I'll get into that later. People are making homemade 3D printed, not just attachments, but actually ventilators. It's a really interesting thing. Hospitals are starting to do a lot of stuff. They're not allowing, by the way, if you have a friend or family member gets admitted to hospital, very soon, if they haven't done it already, you're not allowed to go visit them. There are people, I have a friend of mine, his wife is giving birth with twins. There are basically no visitors. You're going to give birth alone. You'll be sick alone. We're not allowing people into the hospital. Like, there are certain exceptions, but even I heard in some places, even when they die, you're not allowed to go see them, whether it's for COVID-19, for anything else. I had personal experience with that when working this week. So it's really tough right now. Just think about it carefully before you go in the hospital. If you do need to go there, and go there, if you're sick. But, obviously, I'll get to some of that. So I think it's a great idea. We shouldn't have anyone in the hospital that shouldn't be there. Like, keep in touch with an iPad. Give them an iPad before they go in and constantly talk with them. We're going to have to do that. Nurses are starting to do that to patients and even doctors, My brother is endlessly trolling right now. That's great. Yeah, Brian, all Amazon orders are backed up. So if you're going to get delivery from something else, I suggest something else, something small, something maybe, I don't know. But if not, like, you really need to order it right away. If not, then don't. Colombia. Oh, wow. Yeah. So, Quan, good thing that you're over there soon. Some docs say masks don't help. They keep asking for docs and nurses, so they don't want the masks to run out. I'm not sure I understand your question, but here, okay. So, here, I'll get into that. About the masks. So, here's a problem with the mask recommendations. Everyone is saying you don't really need them when you're outside. And I agree generally when you're just walking outside, you don't need them. But if you're in close contact with someone, which most healthcare professionals are, I think you need them. And the CDC website is saying, oh, well, you don't really need more than a surgical mask. You don't need an N95. There's a lot of controversy on this. There are nurses in other hospitals said that they are being told to wear one surgical mask. John, yes, I don't know if I had a false negative, but I was negative. I suspect I had a false negative, but I'm not sure. My friend Brian is finding out, and we'll see whether he has a false negative or a real positive or a real negative. Anyway, so I tell you for a fact, there are nurses and doctors, hospitals all over the country, and I won't name specific ones except the ones I've heard of publicly in New York, that are telling their doctors and nurses to wear one surgical mask. That's the whole shit. And then suddenly when an employee gets sick, suddenly they're saying, oh, well, now maybe you need to wear N95s. And then all the administrators are not coming in to work. They're staying far away. So in my mind, that's a load of bull, you know what. If they really it was important, why aren't they at work? And why are they suddenly changing things when people start getting sick in the hospital? And if you look at every other world and every other country in the world and every other wearing PPE, again, personal protective equipment, full gowns, masks, hairnets, full overalls, goggles, double gloves, booties, and all we get are one surgical mask, one pair of goggles, one pair of gloves, and a crappy little plastic gown. There's something wrong with that. I personally think the CDC and the World Health Organization are behind on all the recommendations. I don't trust this on some of this stuff, and that's coming from a doctor. The World Health Organization was behind on calling this a pandemic when it was clear it was going to become one. The CDC cannot announce that, oh, everyone has to wear N95 in hospital because they know there's not enough around the hospital and that no hospital has enough right now until there's a supply. I bet you once there are tons and tons and they make a lot, then they'll say, oh yeah, now we want everyone to wear N95s. I almost guarantee the CDC will recommend that universally if you're treating even a COVID-19 suspect, an N95 mask for any healthcare worker or caretaker. They aren't recommending it now, but I almost guarantee that later. They just can't recommend it now because there's no supplies and no hospitals can follow those CDC guidelines. That's the problem. Yeah. So Gracie says coronavirus is droplet, general public, and precautions. Yeah. So because I think it is unfair. There are doctors, by the way, that are getting sued and fired already. Okay, not just threatened for being sued and threatened to being fired for using their own stuff or not having enough. There are malpractice lawyers advertising all over the US in some of my doctors groups that are, the lawyers are advertising to people are saying that if your doctor or nurse isn't wearing the right equipment, or they don't give you the test, or they don't give you that experimental drug, call us at 1-800 I'm an a-hole lawyer or something, and we'll sue them. So I mean, what are we supposed to do? This is not fair for us, and this isn't our problem. This is a healthcare problem. This is a CDC, this is a federal government problem, and that has to change because we're stuck in the middle. This is not our fault when the rest of the world is doing something and we can't do it. Yeah, so again, it is important, I think, for this mask and for the surgical mask, not just surgical masks, but the N95s for the healthcare workers. Now, we don't have enough. I've been trying to order them myself. They're stuck in shipment. Probably will never come to me. So honestly, in a week or two, when I get back to work, I may be asking for some donations personally. I don't need now, but we do have enough in our hospital. Our hospital is very set, not set, but we have a supply, and we don't have a lot of cases. And that's, Hawaii generally doesn't have a lot yet. And I'll get into why I think that is. And Hawaii's been doing a somewhat decent job recently. So, again, it's sad, I think, that doctors and nurses are having to make their own masks. ER doctors are doing really sad things. You may have heard that one ER doctor is, yeah, Danielle, I'm going to go into that in the global update. So in their garage in a tent and not hugging their wives and kids for weeks. Now, I've been doing this for 15 days, but I'm single. I could walk around naked all day long if I want, and maybe sometimes I do. Maybe I don't. I don't know. But I live alone as a bachelor. It's easy for me. I can't imagine if I were married and had kids and a wife and a girlfriend living with them. That would be really, really horrible. So, Lynn, if you were flying over now, number one, you should fly. Don't get on a plane. No one should be flying now at all. But if you had to, and if you were, I personally would use a surgical mask. I wouldn't use an N95. I would use a surgical mask. I think that's okay. I would switch to an N95 potentially if I was, and goggles if I was around someone who's coughing right next to me. But the masks really more work for you if you're sick, calling someone else, or breathing hard on someone else. That's where it works more. A lot of people don't understand the masks are not always to prevent you from getting it. It's from giving it to someone else when you have problems. That's the number one thing the mask helps with more. Because again, you can still get sick through your eyes and your ears and other stuff. But you don't necessarily shed tears and stuff as much as you shed vapor and air droplets when you cough and you breathe. So masks are more about you keeping it from someone else. But when you're in close contact, the N95 helps protect you. Okay? Grace, you got to find me a wife. Tough luck. My mom's been trying for 44 years, okay? Or 43. I'll be 44 soon. Okay, so another thing, again, I've been hearing horror stories like you all have. Everyone's finding masks. They want to donate. Some union found a whole bunch, like 5 million masks they're going to sell to people. And you know how much they're selling them for? They're selling them for like $5 or $7. By the way, the normal mask, as I'm sure most of you are aware, N95 mask goes for under $2, maybe $1.50. So people are selling these for 400% times normal cost. I think there's a special circle of hell reserved for people making money off of other people's pain and death and suffering in this time. And I'm not going to judge them, but I think society will judge them, and I think they should be shut down. And unfortunately, it's a market economy right now. States are competing with the federal government is competing with other countries. Everyone's trying to get the same supplies, So hopefully after this, we'll have a ton of them. What do I think about the TB vaccine to be used as COVID-19 vaccine? David, I'll get into that. I haven't heard about that much, but I will tell you what I think about the general vaccines and all the other stuff. So I'll get into that a little bit now. Another thing I heard that they're making ventilators. I'll send you a link later. My friend's friend is making a 3D printed ventilator. It's only $300 because everyone's running out of ventilators. They can't get enough. It's beautiful looking and very compact, and if it really worked, that'd be great. But again, this is the problem for all of you making and sewing masks. That's great that you're doing it, making protective equipment, ventilators even, this stuff. The problem is you cannot just make a hospital use it. The hospital has to think about liability. The purchasers have to work with admin, and they have to be protected that they can use this stuff. Because if they were using it and somehow someone got sick from it and they didn't survive, they could easily get sued. All this stuff you're making, if it's not approved by hospital purchasers and admin, or a law is written by the state to cover them in this extraordinary crisis, then all these things that you're making, events you're doing, whatever, and these experimental drugs, potentially the hospital and the doctors could be sued by it. I mean, I think finally people are starting to realize the struggle that nurses and doctors and hospitals have to work with, that we are afraid of being sued, and we can't just do everything all the time. It doesn't work that easy in most healthcare systems, okay? So anyway, so by the way, I want to show you a picture of this later too. Actually, I'll show you too now. There's an amazing thing that someone has made. So if you can see it right now, there is a plastic thing that someone has made that will help people intubate and protect anesthesiologists and ER doctors. And I think it's a brilliant thing that prevent a lot of spread of stuff. And that's the most risky procedure. You know, intubating someone and putting a tube for the ventilator, they're coughing, the suction is spitting up stuff. And I really want to try to get something like that made. I think I will try to crowdsource that in Hawaii. I think it'll be a wonderful thing to put around every single patient as soon as they get admitted to the hospital and are on oxygen. I think we can make a lot of those. That would be brilliant to have for any single COVID-19 patient before and during intubation. Once they're intubated, they're technically more protected. They're not spitting up as much stuff, so it would be better, you know? So right now, okay, so David, talking about the experimental stuff, I'll go into a little bit about I've talked about hydroxychloroquine and all these other things. Yeah, Brian, simple, right? But doctors have to figure this stuff out. I think we found out about it from other doctors around the world, but it's for fiberglass, plexiglass things with certain holes, and my God, it's so cheap, and it would help everyone, I think, technically. Every doctor. It should be in every ER, ICU, COVID-19 ward, ICU crash cart, and for every intubation tray, I think. Yeah, it's easy and it's brilliant. I personally want to make this a thing. Like, I want to make it like a thing that happens. I think it will be brilliant. I would love to have at least a couple of those in my hospital. So again, as I mentioned in the last podcast, there is a certain trial. It's called the Solidarity Trial. Look it up. The Solidarity Trial is being set up by the World Health Organization. They recruited their first patient about 2 days ago from Norway to test out all the things that all you guys have been talking about. But I think they're focusing on 4 drugs first. The number 1 is the most famous one, hydroxychloroquine and azithromycin. Number 2 is, I think, remdesivir. And I think another 2 are some other antiretrovirals. I think, I'm not sure if it's ritonavir or some other stuff. And again, I have to mention and to answer David's question, I haven't heard about TB medicine, and I don't know what you mean by TB. Or I think you're talking about malarial medicine. Again, the hydroxychloroquine, not the TB medicine. I haven't heard of any TB medicine being used for COVID-19 as a research drug. So again, you heard about all the hydroxychloroquine things, the overdoses, different things. I got to mention that guy in Arizona who overdosed. I'm sorry, he's kind of an idiot. He listened to Trump, and it was not about listening to Trump, but he just took hydroxychloroquine aquarium clean. That's the equivalent of drinking bleach. Just because there's a hydroxychloroquine or some chlor or something in it, and he died, and his wife is in the hospital. So if you're the sort of person that listens to everything on the internet, think he didn't even have coronavirus or COVID-19. He just wanted to protect himself. Stop reading on the internet. Stop asking people who have no idea what they're talking about to give them medical advice. Listen to other healthcare professionals and doctors, okay? So again, there's not a lot of evidence about other drugs. I read a little bit more about hydroxychloroquine. Major problem with that study, again, only 42 patients, number 1. Number 2 problem is it was only in vivo results, not in vitro, in vitro results. What do I mean by that? It only tested the concentration of nasopharyngeal COVID-19, sort of the concentration of it. It didn't test what was actually going on with the patient. It didn't say that the patient survived, they died, they didn't, whatever. They also left a bunch of results for some of those patients. And number three, the main author in the study is like on the board of the journal it was printed in. There's a problematic like observer bias, really, or there's a self-interest bias. It's like a stock, it's like Elon Musk saying Tesla's great. Like, you can't just trust someone who's part of the journal where they release it in. There's a lot of conflicts of interest. That's the name, okay? List of action items. Okay, Lisa, I'll get into that at the end when I can tell you what I think everyone can do at the end, okay? So again, not a lot of evidence of the other drugs yet. Keep your eyes open for the Solidarity trial. That will talk Remdesivir from Gilead, Kevzara, I think, from Regeneron. I think the other big thing they're really focusing on is on antibodies. Allison, someone already mentioned that already. Someone already mentioned that. The 5-minute test, that's great if it works. I don't know that it's going to be available very, very soon. I'll believe it when I see it. It would be great for the ER. It'd be great for clinics. It'd be great, great, great. But I doubt that every state will have access to it within the next 2 weeks. And the next 2 weeks are already really problematic because everyone is getting really sick, especially in New York. So I think number one treatment will be either the vaccine, or I think it will be in a year, which will go off of maybe plasma or other types of things, or inactivated virus. A lot of times these vaccines are inactivated COVID-19. Again, they can't rush this through. If they rush it through and they create a COVID-19 super virus that gets everyone super sick and kills them, then that's tough. So you cannot rush through a vaccine without the right trials. This is how horror movies start and The Walking Dead, because you rush through things and you make a super virus. I think that getting plasma from people who've been infected and recovered and have the IgG is going to be key, not just to testing IgG and having a good test, but also covering for a potential vaccine down the road, an inactivated virus vaccine that all those anti-vaxxers are going to be first in line for immediately. And if they don't get it, too bad for them, Fine. I'm glad if they don't get it. If they don't want it, then they shouldn't get it. But I really hope that they do get it for the rest of humanity and all that stuff. And that goes into herd humanity and some other things. I want to talk about herd immunity, not herd humanity. Herd immunity, everyone's been talking about this. Why don't we just get everyone sick and let everyone get exposed that's younger and isolate the older people? Hey, guess what? England tried it. They immediately realized it was a horrible idea and they backtracked on it. If you didn't hear, by the way, Prince Charles is sick. And Boris Johnson is sick. That's like Donald Trump being sick, and I don't know who's royalty here. Like, I don't know, Kanye West or Ivanka Trump or something. I don't know. So, England already realized herd immunity is an awful idea, at least right now when we don't want to overwhelm the care system. There may be a role for it later. There may be a role for it, and there is sometimes a role for it in certain things like measles and stuff that we're not worrying about a huge spike right away. But COVID-19, what's the whole point of it? What do they call it? A novel COVID, a novel coronavirus. It's novel. It's new. It means that the world hasn't had a chance to be exposed to it, so those things are going to spike through the roof. So everyone that wants herd immunity, I'm sorry, I vote that down. I vote against you. And this is coming from a health professional, a doctor who has dealt with a lot of these diseases a lot of time. And again, stop talking about all your fake, throw them out the window. Every day someone's putting up a new treatment. Again, I talked about earlier about people thinking that you could blow dry hot air up your nose and your eyes and you would cure it, and gargling stuff. That's all ridiculous right now, okay? LeBron James, yeah, that's a good point. LeBron James being royalty. Oh, talking about it, yeah, David, I'm going to go all into the update in just a little bit and what I think the pandemic will reach. Ryan, is it a good idea to get a flu shot right now if I didn't get one this past winter? Ryan, first of all, everyone should get it. And yes, I think if you can get it safely now, it'd be ideal. This is why you should try to get it as soon as you can. Because, now you are exposing yourself to a little bit of risk going somewhere. But you can go to a clinic still, call ahead and make sure that you can get a flu vaccine. It's 100% good. Because if you get sick and you're really sick from the flu, where do you think you're going to end up? You're going to end up in a hospital getting treated or ruled out for COVID-19, and you don't want to end up there if you don't have to. So still get a flu vaccine. Fun fact, Australia, the Southern Hemisphere, New Zealand, and Africa are entering flu season because it's coming our spring and summer in the northern hemisphere. In Europe and Asia, it's coming into spring and summer, and I'll go into the temperature aspect of that. But in the southern hemisphere, it's going into what? Their fall and winter. So they're getting their flu vaccine. My personal opinion, and I have no evidence right now but Will's prediction is that I think that those countries, we're going to get hit very, very hard in their fall and winter. New Zealand, Australia, Africa, South America, all these places that were not feeling it before, as they get colder and they start getting flu and other things, they're going to get hit super hard by COVID-19, and they're hit hard yet, as you can all tell by the world statistics. So last week, as I talked about, I already predicted that we would be around like 50,000 or more. And obviously, as you see the numbers, we are right now in the US at 110,000 or so. Some states, as you can easily tell, are much better at it. And, you know, these are like North Dakota, South Dakota, Puerto Rico, Hawaii. Are you noticing here? Nebraska. These are a lot of the isolated, geographically isolated, less sparsely populated states. And the ones that are really getting hit hard are, you know, New York, New Jersey, Illinois, California, Florida, and Louisiana. All of you who've been watching my podcast know I predicted Louisiana like a week, 2 weeks ago even. Like a long time ago, I was predicting Louisiana would be really bad. Here's a reason why. Hint, look at which states have the highest mortality or the lowest life expectancy in the US. Why? These are states like Mississippi, Alabama, Arkansas, and Louisiana. High diabetes, Cajun food. So these are all what? Comorbidities. These are all states where people don't live long because they don't take care of themselves. They have kidney failure. They're on dialysis. They have maybe high rates of smoking, other things. So my prediction is those states are going to get hit worse, and Louisiana is getting hit real hard. I'll get into it after I get into the Hawaii update. So again, as I've mentioned multiple times, I don't think there's just this one spike. We're going through our big spike right now in the US, and pandemic-wise, I think it's going to spread. As I told you, I think the Southern Hemisphere is going to get it really bad in not just April, they're going to get it in May and June and July. I think the Southern Hemisphere that is colder with flu, like Peru, Chile, Argentina, New Zealand, all the African countries. South Africa, if you look at it, is starting to peak. Why? They're probably the most visited country between Cape Town. They're very international. Ryan, is Hawaii doing a good job of the hammer and the dance? Okay, so I'll get into Hawaii right now. So here's an update from Hawaii, because I've been on the ground. This is just not medically, but socially. When Ryan's talking about the hammer, he's talking about the thing where we, boom, instead of it going up like this, we like peak and we're coming down. So let me show you a good example of the hammer. And I have it here in South Korea. So if you look, and this is the thing you should be looking at more, okay? It says active cases in South Korea. Do you see right over here, this thing, the hammer? This is the graph you should be looking at more. Active cases, not total active cases. South Korea started to hit that hammer and going down. This is what we want to see more, okay? So who hasn't hit that hammer yet? There's a new website I found that has a great thing about each country. I want to show it later. But look at Hawaii now. Okay, and I'll send the link about how to find this, okay? So if you can tell, right now, Hawaii is doing pretty well compared to average. Hawaii's up down there below the average, near Nebraska and South Dakota, and New York and New Jersey and Louisiana are doing really poorly, okay? So Hawaii is starting to slightly flatten and is better than other people, but we're not past it yet. No state is hitting the hammer. 0 states out of America are hitting the hammer, okay? So, yeah, and so you bring a very good point. A lot of super spreading happened at March, LA Marathon, March. I'm going to tell you the next big thing is Easter. Keep all your religious friends, especially the super religious ones, especially the mega church ones, home on Easter. Easter is going to be the next super spread thing coming up. Easter Sunday and Easter week. And I'm going to tell you, that stuff is going to hit the Catholic countries, the Mexicos, all of South America, maybe not Italy and Spain because they know that it's a big deal, but it's going to hit those Catholic countries hard because they have all these Easter festivals and masses, and unless someone tells them to do the right thing, it'll be bad. But Hawaii, here's an update. I'm sorry, Michael, I'll get into the mortality rate of COVID-19, but it's not great, okay? Ryan, surfing is not illegal. In Hawaii, if you straight to the beach right now and go right out to surf, you're fine. You may not be able to park at the beach park, but you'll be able to go surf. That's what I'm hearing right now. Hawaii update, this is really interesting. So now we're up to 122 cases, 0 deaths in Hawaii. 122 cases, 0 deaths. They thought they had 1 death. It was a fake, not a real death. So they misread it. The supervisor misread it. It's like a fake missile warning. They had to renege the death pronouncement. So no one has died of COVID-19 in Hawaii yet. And we've been doing a lot more testing. If you look at per capita, the states that have done the best testing, Hawaii has actually done pretty well. For a state of only 1.7, 1.8 million, whatever, we've done a decent amount of tests. I don't know how many, but this is what I'm reading. So they're anticipating that the peak will be expected in April to end of April for Hawaii. I personally think for geographical and population density and city reasons, Hawaii will be one of the last states that will be hit. Both geographically, I think it hits the New York area first, and I've been talking forever, I'm not making it up now, and hit the bigger cities later, the Chicagos, the Miamis, the New Orleans is bad, Atlanta is really bad, and the more isolated Puerto Ricos, like San Juan, Puerto Rico, Honolulu, the North Dakota, South Dakota, Nebraska, these ones are not going to be hit as hard because people don't visit, they're geographically more isolated. That's good and bad. That gives our states more time to prepare, like Hawaii, but we have to wait longer potentially. So it's kind of tough, Brian, yeah, so talking about people getting tickets, Hawaii has cited, meaning they've warned but not ticketed 70 people as of like 2 days ago, and they arrested 2 people for being outside. They actually stopped people on the outer islands. Those 2 arrests are kind of fake. Like someone was out on house arrest and wasn't supposed to, or had a restraining order, and they caught him, and he was also out when he shouldn't have been. So of course he got arrested for that too. So they are starting to cite people in Hawaii. But Hawaiians are taking stuff into their own hands. Again, there's video I'll show you later of, again, the Maui people locking down the road to Hana and kicking people out. A couple and a family that came from the southern part of the U.S. was basically attacked. Dad was almost run over from a local guy that told him, hey, tourists, go home, you have COVID-19. In all honesty, that's not fair. And the family probably shouldn't be around. But that guy probably would have done it anyway, because let's be fair, there's a lot of racist Hawaiians that don't like tourists. Hashtag Howley go home, stuff like that, okay? So again, I believe the peak for Hawaii will be mid-April. Things have been, pretty well. They started the 14-day mandatory quarantine on Monday. People are still allowed to do takeout. A lot of what are called essential businesses, and that involves a lot of things, healthcare workers, grocery store people, a lot of people are involved and still going to work. Traffic's really good now. I went to get curbside takeout from Duke's restaurant, Duke's Waikiki yesterday. Nobody was there at 9 p.m. Curbside takeout with my mask, and I got it after a full week of work in the hospital. And again, the citation is apparently a $5,000 ticket if they actually start giving it, which they haven't done it officially to anyone in Hawaii, and a 1-year prison form. All beaches are blocked and patrolled, and that's kind of the stuff that's going on. Hawaiian Airlines has canceled all their flights, all of theirs. They did the right thing. Other airlines, American, Delta, other stuff, were not doing well, and they're still having flights. I mean, and in reality, you do need some flights, to bring people back home that probably should have come home way before. And for medical personnel and medical stuff, there are reasons you do need a couple flights. So I have no problem with a couple of flights. Oh, really good statistic. Locked down Hawaii from flights, which was Thursday. They noted a 95% on typical Hawaii, 30,000 people fly in. Only 1,500 on Thursday. That represents a 95% drop. So that's great. I love that that's happening. I hope that's happening every day, that there's only 1,500 people flying into Hawaii every day. Monica is giving $400 tickets. Tommy, how many states do I be epicenters like New York? Tommy, I believe the major big cities, I mentioned them previously in my podcast. That includes Atlanta, Chicago, Miami, New Orleans. These are going to be the big ones. Parts of New Jersey, maybe. I think California, believe it or not, may not be there as bad as the ones on the East Coast, because I think San Francisco and LA are doing a slightly better job right now, okay? But I think Chicago, Atlanta, and I'll get into this, in New York, New Jersey, Miami are doing worse. So I will tell you right now, Hawaii's doing other things to look at stuff. The testing, again, is a lot now. It's a 2-day turnaround. Hawaii is looking at other things that I recommended that they look at. Not because of me, because I think they're good ideas. The Blaisdell, where they have all the concerts like Justin Bieber and Joe Coy and other people performing, that may be a triage area or for overflow for patients. The Hawaii Convention Center right next door to me, like 100 feet away, may be a major center. And it may not be for COVID-19 patients, but maybe for all the other patients who are not so sick, that we can empty the hospitals. So the hospitals, COVID-19 patients, like I would take care of like 30 COVID-19 patients in a day, maybe, let's say. So Hawaii is working out pretty well. It's a little scary. We're still not seeing a ton of cases. Of those 122 cases in Hawaii, I think only 8 are in the hospital. Only 8 in the entire state are sick enough to be in the hospital right now, but some of them are really sick. There's a 38-year-old totally healthy bartender who got sick in Waikiki, and he's intubated right now. I can tell you this story because his family tells it on the news and wants everyone to stay home. He may not make it, and that goes into what other people are saying. What is the risk once you're intubated that you come out? The numbers don't look good. The early numbers I see say that only 10%, maybe only 20%, 10 to 20% of people come off of that ventilator once you get on that ventilator. Maybe it's the younger ones, maybe it's the healthier ones. Remember, the sickest people are the ones that get ventilated. And I'm hearing like sort of concerning things that even, healthier people who are under 40, that's cases in the US. Half the cases, or 40% of the cases in the hospital, not diagnosed, in the hospital, are under the age of 40. That's concerning for us, So to tell you a little bit more about what's happening in Hawaii, they're starting up more telemedicine. I'm being recruited to work, and I may work for my time off coming up for telemedicine in California, in New York. They're asking doctors like me and people to come out of retirement to fly to New York, to get put up in the Four Seasons and work some crazy shifts, 10 to 12 hour shifts. There are nurses that are leaving Hawaii right now to fly to New York to get paid $5,000 a week. $5,000 a week, that's doctor money, like decent doctor money to work shifts, because New York is getting screwed over. And let me, sort of go into New York a little bit. It's really looking pretty bad right now. Again, a lot of the PPE is running out everywhere. I think the federal government is finally starting some of the stuff in New York. A little too late, in my opinion. They should have been doing this a week ago. And New York's getting hit really, really hard. About 30 of the states, a majority, have a shelter-in-place rule going on right now. Obviously, the major ones, New York, New Jersey, and Connecticut, are under threat of a quarantine by Donald Trump, President Trump. And as I understand, it's not your typical like lock everyone down quarantine. They don't want people to travel outside New York. What they're seeing is major cities, Miami, Atlanta, New Orleans, all these other places, you're getting a lot of the visitors are leaving New York, leaving New Jersey to do what? To go to other smaller towns and areas. And as they spread out of New York, they are spreading their asymptomatic COVID-19 illness with them. That is causing a lot of problems. Ryan asks, do I think it'll mutate before viable vaccine claims? Ryan, the initial evidence shows that it's not mutating yet. So that's good, but it doesn't mean it can't. It could mutate, so we got to watch out. Mutate, I don't see it happening right now. There's no evidence it has. There's initial evidence that there's 2 strains out of China. One slightly worse, one slightly better. But for a test result, that is Stacy, doctors are telling a lot, and companies are paying them. But you know how much a doctor gets paid for telemedicine? Take a guess. I'll tell you, it's not that much. Some of them are only getting paid like $20, $25 for a consult. For a medical consult, they're getting paid $25. I know hairdressers that make more per hour. I know, and no offense against servers and whatever, I know servers and bartenders that make double that in an hour, you know? So, you know, doctors are doing it, but there's not a lot of incentive for them to do it. And I will try it, I think, because I'd like to help out my community in other states, but it's not a lot of it's not a big money maker, let's say. And I personally think insurance companies should be paying a little bit more. I mean, you know, something more. $25 for a medical consult is really kind of not much. And again, I will anyway, and I will start. And there are some companies that are paying more. I think one of the companies in Hawaii is doing, and they're charging $50 a consult, private pay, no insurance. Okay. Yeah. So again, New York City, they're getting hit super hard now. I'll tell you, I almost anticipated that this would happen, and I've been for days. It's my home state. I was born there. NYU is getting killed. New York Presbyterian is getting killed. Elmhurst Hospital is getting absolutely annihilated in Queens. And Jacoby Myers, a bunch of, or not Jacoby Myers, Jacoby up in the Bronx or Harlem, I think, is also getting killed. They've got thousands of cases there. New York still has half the cases of America. New York State has 56,000 cases or something. That's half of the 110,000 cases in America. So it's not really good in New York. They're getting people out of retirement. Doctors to work there. And again, doctors are afraid and nurses are afraid because they'll get sick, like I'll mention about Italy and Europe. It's really, really bad, okay? Stan says, surely coronavirus won't last long because the main channel. Ha, 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 Stan. Teleconsults usually last. Ryan, I don't know that a single doctor can do 5-minute teleconsults ever. You have to write. You have to, send out stuff to the pharmacy, do other things. It would be very, very hard for anyone to do a teleconsult in 5 minutes. I think almost impossible to do it in less than 10 minutes. So it's more like $120 an hour. And again, you're seeing 10 patients. You have liability from that too. So there's malpractice that can come from a lot of this. So, it's not just about seeing it. Everyone likes to sue doctors when stuff doesn't go wrong. Trust me. I know a lot of doctors who've been, so, it's not as easy as that, You can do telemedicine. So as Grace mentions, it's 10 to 15 minutes. Nobody can do a 5-minute telemedicine consult. If you were a patient and the doctor kicked you off after 5 minutes, how would you feel? Look at it that way. You wouldn't be very happy, So New York City is getting hit really hard. As I mentioned, I posted up, the refrigerator doors have been refrigerated trucks outside hospitals so that when people die, they dump them in the trucks. It's getting really, really bad there. There are hospitals that have 1,000 cases in the hospital, not of patients of just COVID-19. 1,000 people in a hospital that are only COVID-19 patients. And a lot of those are sick and intubated all at the same time. And it's easy to say, oh, let's just get in the ventilators and they can get intubated. We'll just intubate everybody. You get an intubation, Oprah style. Who runs these vents? Can you run a vent? Are you an RT? Are you a critical care doctor? I didn't think so. So it's not that easy to run a vent. You can learn basics, but it's not that easy to just learn a vent and learn how to use it. I've known how to do it because I've been doing it for 14 freaking years. Not everyone can do it, and I'm not even an expert. I wasn't technically trained in it. I just had good critical care training at Cedars, which had a great ICU training program, and I've been doing it and intubating people for 14 years, so I know how to do it. It is not just, just give them the ventilators and put everyone on a ventilator. When do they come off? And by the way, your typical person with COVID-19 is staying on the ventilator for something like 2 to 3 weeks, almost 3 weeks, so it's a lot. And, it's hard to get them off. They have bilateral pneumonia. They have ARDS. Everyone hears about ARDS. What is it? Acute respiratory distress syndrome. Look that up on Google. Google ARDS pneumonia x-ray and look at what that looks like. It's really freaking scary. When the x-ray looks like that, which is almost a patchy whiteout of the lungs, in COVID-19, it tends to be more peripheral, but it's bilateral. It's very scary. You can't get someone off the vent tricks and turn them upside down and set their PEEP and pressures in a different way and do all these different things, but you're not going to get them off the vent. You may make them more comfortable. They may breathe better, but you may not get them off the vent. Okay, so that's what the scary thing. So New York is really struggling with that. As I mentioned, I'm being recruited to fly. I will not fly to New York. I really want to. I feel bad for them. But if I fly out of here, when I come back, I'll be quarantined for 14 days. Technically, healthcare workers are exempt from that. But I know Hawaii's time is coming, and it'll be really bad potentially mid-April, end of April. Here for Hawaii, and I'm telling you, it's scary to be in New York. If I could go and I wasn't working any other way, maybe I would go. But it is very dangerous for obvious reasons. Again, one other good thing about New York, with all the depressing stuff, the mortality rate or case fatality rate is only 1.4% after all this. That's still not that bad. That's not better. That's not a lot worse, but not a lot better than numbers that we wanted. Okay, as good as Germany. Germany is a 0.6% case fatality rate. Okay, so they're doing almost, or 0.7, I think. They're doing almost as good as South Korea. You know who's doing really bad? Louisiana. Louisiana, their case fatality rate and their mortality rate is 4%. We're getting to like China numbers there with Louisiana. Italy's was 8% the last time I saw. It's really bad in Italy. But again, Louisiana is much worse than New York. New York's got worse numbers, but it's 1.4% case fatality rate right now. So it is, one bad thing is a lot of the first responders are getting sick. They announced on news, I think CNN, that 15 to 25% of New York police officers and fire department are sick already. 15 to 25% are sick, meaning they can't work right now. So what happens when the nurses and doctors get sick? And that's happening a lot in like Italy and other places. I'll get into that. So again, I mentioned the hot zones coming up, I think, and I'm marking this now: Chicago, Illinois, Atlanta, Georgia, New Orleans, Louisiana, Miami, Florida. In my mind, and Detroit, Michigan. Those are the big ones I think that are coming up. And yeah, San Francisco and Los Angeles got to watch for these bigger cities, even the Bostons and whatever. But those are the 5 I see on my list: Chicago, Atlanta, New Orleans, Miami, and Detroit. And they also, some of them, really unhealthy populations in both, Detroit and especially New Orleans, and Atlanta on some level too. You may have heard, and I want to put a lot of people at ease, the first infant died in Chicago. Now everyone's going to freak out. Yeah, kids aren't supposed to get this. They're not supposed to die. But it's sad. Yeah, someone died, and I feel really bad for parents. Before this infant in in that setting, he may have had a lot of other diseases. Not to say that they would have died anyway, but they may have been. We don't know the details. And eventually, some infant, some kid is going to die of this. It's inevitable. It's sad, but we need to move on from this. And, is there something else that can protect kids? Andy, yeah, Hawaii is probably going to don't bend the curve the right way. And a lot of these projections and these numbers are based on how you bend the curve. So you can't pick one everything. But you're right. We have a lot fewer beds than California does. California has way more hospitals. We have something like 9 hospitals on this island, maybe 10 depending on how you count it. Becky asked, take into account smoking cigarettes for hot zones. Smoking cigarettes is a part of the hot zone thing, and that's why they think Italians got hit hard. Smoke a lot in Europe. A lot of people smoke in Italy. If you've ever been to Italy, they basically smoke in one hand and have a cappuccino and espresso in the other all the time. So, they're smoking all the time. And, I would tell everyone right now, if there's one thing you can do to stop your chances of getting COVID-19, it's stop smoking, stop vaping, even pot. Everyone's like, oh, I can just go smoke pot. No, anything you stress your lungs under will stress you for COVID-19. I really believe this. Again, I don't have a lot of evidence. So why take the chance? I don't think you should be smoking anything at all while we're dealing with this COVID-19 thing. John, I mentioned this on all my prior podcasts, so I refer you back to that one. I think it's a bunch of nonsense, and it's also case projections of type A versus type O and versus type A, and it's a big Korean Asian thing why people want to believe this. It's a total retrospective study that means absolutely nothing. I don't believe in this. and I need it proven later. I don't buy anything into that. Maybe it happens, but what does it do? It doesn't help you treat anybody. You're still going to treat everybody. You're still going to, protect yourself and self-distance like everybody. So again, those are the hot rates, and I told you why Louisiana is really bad. Again, New Orleans, Louisiana, Alabama, Arkansas, Mississippi have high morbidity, mortality rates. They have a low life expectancy. All those states, I expect after this is over, are going to have the highest case fatality rates and the highest mortality rates from COVID-19. Check it later. Again, this is what I predict because we're talking comorbidities. They have the highest comorbidities. It's simple math, okay? Again, the bottom states are doing better, the smaller states, Hawaii, Idaho, North Dakota, South Dakota, we're doing better. Puerto Rico, we're getting hit later, but doesn't mean that we're out of the woods. Everyone's got to self-distance. Ryan asked, do I think Jägermeister helps them keep their death rate low? I bet you Germans would love to think that, but I think, again, my feeling is literally, I think culturally there's fewer Germans that hug and kiss each other and spend time around each other. Really, right? You think about it. There are a lot of Italians and Spanish people that live in multi-generational homes and are constantly like each other and having massive gatherings. And Germans, they're, again, not well known for being very touchy-feely and all right up in everyone's business. They kind of stay away from each other, and they're not constantly, unless it's Oktoberfest and they're going crazy at the beer halls, they're not one of those cultures. I think, honestly, there's a cultural component to this, and we can learn a lot from the Germans, honestly. We could learn a lot from the Germans. John asked, Josh Green is running Hawaii Response. John, asking about that, Josh Green is helping. He's back on board now. There was a period last week where there was rumors that Governor Ige kicked him out, but all the doctors complained, all the newspapers and media outlets shamed Governor Ige, because again, Lieutenant Governor Josh Green is an ER doctor, and he's back on board, so we're happy to have him on board. He is, I think, Hawaii's silver bullet for COVID-19, because he knows how to. He has a master's in public health too. He's not just an ER doctor, so I'm happy to have him on board. Because I'm not the one making decisions. He is, Vodka, Gennady. So everyone, if you guys want to drink, maybe it'll help, but I don't think it's going to take care of the virus. If anything, you might just get drunk and aspirate and give yourselves a pneumonia, end up in the hospital anyway. So do what you want. I may have a little glass of whiskey at the end, but I don't think it's going to kill it. So other things internationally, I mentioned about Africa and low rates because of hydroxychloroquine as a theory that they take for malaria. But again, I think it's because it hasn't been cold yet and people haven't been visiting it yet. South Africa's starting rise in the rates. Cape Town is getting hit. All the other South American countries, I think, are going to start getting hit. New Zealand, Australia, all these countries are getting into fall and winter, and so I think they're going to get hit harder. Again, I mentioned about UK shelter-in-place laws there. Prince Charles and Boris Johnson have it. Germany is doing pretty well. They've, again, banned all gatherings greater than 2 people. Case fatality rate is only 0.75%. That's not a lot worse than Korea, which is like 0.6 or something. So Germany's doing very well. Spain, it's still pretty bad. They're not letting tourists. They're not letting any foreign tourists in. A lot of their healthcare workers are sick. 10% are sick. 51 doctors in Italy died of this already. They died. They didn't just get sick. 51 doctors died. That's a stat that frightens me in Italy. But again, they got hit very, very hard. Again, some of the theory is that Italy may have a higher mortality rate because they're focusing the people. They're not focusing their testing on all the other people out there. So that may be why their fatality rate is like 8% or more right now. And again, they smaller family circles, they tend to be smokers. These are all theories about why Italy is getting hit really, really hard. One really sad story, I heard about a nurse in Italy that tested COVID-19 positive, and she committed because she was so sad. It's a sad, sad story. She may obviously have had other stuff going on. My heart pours out for her and her family, anyone else. It just tells you the pressures that doctors and nurses are going under at this time. We have to take care of ourselves, all of us. I'll get into that. In Mexico, I didn't mention that in South America, but I think, and I predict it right now, is going to be a massive hotspot soon, along with certain other places. Mexico, the president is saying stupid stuff. Not just Trump saying some crazy stuff, but the president of Mexico is saying poor people can't get coronavirus, quote unquote. He's only banning gatherings of 100 people. 100 people. Because, it sounds bad to say, but if you say you're going to ban a gathering of 10 people in Mexico, that like every Mexican family has 10 people, Animal gathering has more than 10 people. So they're only banning gatherings of 100 people. Mexico's not ready for this. And again, they're a deeply Catholic country where Easter is coming up. So unless they start banning bigger things and masses and they cancel Easter, you need to cancel Easter like you cancel Olympics. I don't mean the holiday. Everyone should still celebrate it and pray and do virtual masses. I think the Pope should go virtual mass and everyone should stay home. But if you do not ban Easter services in the world, the Catholic countries in South America and everything are going to get hit very, 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 very hard, okay? The other one I'm worried about is India. And if you want to look at my video on the Traveling Doctor Facebook page, beating people in beat them on mopeds if they find them outside. So literally whacking them with sticks. Cops are going funny, but they need to. Because the idea of social distancing in India, I mean, it's ridiculous. I can't imagine. Have you seen a train in India or a train station in India? I'll show you some pictures of a train station in India, okay? This is what a train station looks like in India. This is what a train looks like in India, okay? This is what a train looks like in India. Does that look like social distancing to you? No, so India is 1 billion people, and it's really, really hard to social distance. So India, with more than 1 billion people, more like China, if they don't do the draconian measures that China did, I think India is going to be the biggest public health crisis of the world. That's my prediction right now, India and Bangladesh. The other countries are starting to come up after told that we're okay. Russia and Ukraine, Russia was not having a lot of cases. Maybe they didn't test very well. Russia is locking all their borders finally. So maybe they just weren't testing. Maybe Putin didn't want to. There's a famous photo going around now. Putin in a full-on hazmat suit. Normally this guy goes around shirtless on a horse, but he's in a full-on hazmat suit visiting a hospital. So stuff's starting to get real in Russia too. South Korea, as I mentioned again, is doing pretty well. And again, the curve for South Korea, the hammer is hit, okay? So the active cases in South Korea, the hammer is really hit, and it's getting a lot better in South Korea. I have to confirm with my friends on the ground in South Korea. But one of the concerns is that other countries, China, Singapore, Hong Kong, South Korea, are starting to see the second wave coming, the uptick. Why? Because people are flying back into their country. China is banning everyone else from coming in. As far as I know, the only one that's doing really, really well is Taiwan. Taiwan is doing pretty well, and they did it without the help of the World Health Organization. Not to be all political, but China kicked Taiwan out of the World Health Organization. They didn't want access, and Taiwan's done an amazing job. Every country should do it like Taiwan, which has a very populated city like Taipei, as anyone who's been there knows. John, quick word about hydroxychloroquine. There's still tons of hydroxychloroquine shortages everywhere. Nobody can get it in the pharmacies. Nobody can get it in the hospitals. My hospital is still looking at a 3-week out delivery. It's very hard to get it. No one who should not need it should be having it right now. No one should be hoarding it. Doctors are prescribing it for themselves, I've heard in other states. That is horrible. That goes against the Hippocratic Oath against doing. There are hydroxychloroquine shortages for a drug that may or may not really work in the end, So India is pretty bad. And again, as I mentioned, I'm going to start wrapping up because this is going way overboard, but I know I haven't done a podcast in a while. I am very worried about South America and Mexico going into winter and flu season. I'm worried about Australia going into flu season. I'm worried about Africa just because they're poor and have poor resources. And I'm worried about India and Bangladesh and really populated, highly dense areas that are not able to put in sort of the public health initiatives and draconian measures, even self-distance. I mean, you just can't do it. In a lot of these places. So I'm worried about those areas coming up. I know I'm worried about us, but I'm looking ahead of the ball. I'm looking 2 months from now. That's my prediction. And I'm not an epidemiologist or a master's of public health, but I've traveled, as you know, I'm the traveling doctor. I've traveled to 73 countries. So I've seen a lot about what countries are ready for this and which ones are not ready for it. And it has to do with population density and what the governments are willing to do and a bunch of other cultural things and travel and economics that I'll get into on other podcasts. So here are my last suggestions. These are what I suggest we need to do. Federally, I think we need to minimize the distribution of medical supplies, field hospitals, vents, masks, PPEs for all the hot zones, all those ones I mentioned in like New York, New Jersey, New Orleans right now, Miami, Chicago, Detroit, those ones, the federal government needs to go in right now, not just deliver them ventilators and more masks, whatever, but set up field hospitals, get the National Guard in there right away, right now. They need to do that now. That's my advice for the federal government for those states. Other states should be watching them to get ready for it. You obviously can't roll this out in all 50 states, otherwise you spread your resources thin. But the National Guard should be put on alert in all 50 states, and I think they have been. And then I think as the other hot zones start popping up in like Nashville, there's another hot zone I heard about, Atlanta, again, Houston or like San Francisco, LA, you start doing that, but you roll out all that stuff right now, not just New York, roll it out to all cities right now. And then when they're hitting their hammer, so to speak, you can start reallocating resources to some of the other states that need them. You really do need that. I also think you should halt all flights except for medical purposes into or out of hot zones. All those cities, all flights should be banned. All flights, not just from other countries. Domestic should be banned. And I know the airlines don't want to hear that, and it sucks, but that should happen. I think we should stop just doing warnings. I think you should give a ticket right away. If you can give someone a jaywalking ticket for $100, stop with the warnings and the citations. Give them a $100 ticket. It's enough to be annoying and enough to make news and make people stop. You give out like $1,100 tickets in a day, people will learn real freaking quick that they're not supposed to be. And then second time offense, $200. Third time offense, $500. Fourth time offense, $1,000. Do it, and then I think that's what every state should be doing, but specifically Hawaii, since we've already put that rule into place. The other states have not done that. Hawaii is a little bit ahead of the curve on that because we're citing people and ticketing people, and it sounds like Santa Monica and LA are doing that too, and actually giving people that. Now, I don't know, there's walking around. That's a load of horse what. A Hawaii guy said he got ticketed for walking his dog around, and he was up on a Facebook group. He was walking through a park. The parks are closed. The signs state that clearly. And of course he got a ticket. So that's his own fault. If you don't listen to the state government, then you get a ticket, you get a ticket. The other thing I heard is that you're going to need papers now to go around. You don't need papers from what I understand. I mean, if you have something from your work, it'll probably, but in Hawaii, I just carry my medical license and my hospital badge around. I'm sure that's fine for, when I go to work. Otherwise, there's nothing preventing people from getting quick takeout and going back safely, of course. So, I want to end with a little bit of inspiration, some last advice, because this is getting really long now. My first sort of inspiration, and this sounds like a weird thing to inspire people, but I expect to be 100% from COVID-19 after all this. They're saying that people are going to be 40, 70% of people are going to get sick eventually. I think with my profession, I probably have a 75% more chance. Maybe not 100%, but very high. This is also, semi kind of liberating for me. And I may have been sick already. I may already have IgG, but I don't want to get sick. But I think a lot of healthcare workers are going to get sick. And I think when we accept something, we can do everything we can to prevent it. But I'm not necessarily living in fear of this. I think I'm healthy enough and young enough. I'm glad I'm not like a 75-year-old doctor coming out of retirement. But, I think there's a little bit of empowerment in accepting an idea that we may get sick. Half of the people we know, half the people on this podcast right now may get sick. And I think there's something to be said about that. But, going along with that, I think that you got to know that 80% of people, again, are going to be totally fine, mild case, and not hospitalized. And less than 20% of cases will need some more care and are hospitalized. And those tend to be, again, a lot sicker, a lot older people. Not that it can't happen to younger people at all. I think that it's inspiring that we're getting a lot of military volunteers. They did out a call to medical volunteers from the Army, military medical volunteers. Something like 6 to 9 people answered the call. So that is inspiring to me that people are willing to step up and help each other and donate stuff. That people on a local level, and this is what someone asked, what can you do on a local level? Contribute to mask sharing thing. There's crowdsourcing things. I think there's like a mask share. I forget the name of it, but I'll find it out later. And you can post up on the Facebook COVID-19 site if you need stuff as a nurse or a healthcare practitioner, or doctor, or hospital. People masks, or like sell them for cost, ideally, not for like, $8 a mask or $10 a mask, or being a price gouger, not being an awful person. I see good things that families are starting to spend more time, and be self-sufficient. Like, I've learned how to cook a lot better. I learned how to cook pasta alla amatriciana, my favorite Italian dish. I've been cooking a lot more, and my has gone down on some level. People are being better human beings generally and helping out each other. These are the sort of times that show you if your friend and your neighbor is a great person and caring, or if he's an awful human being, and I would think that I would want to know that right now, and I would hope that most of these people, most of you, are human beings that way. And going into that, I think it's very important right now that Stacy, about tripling the full full warehouse of masks, that may be possible, but again, if they're expired, it's hard to know whether they would actually be useful. So hopefully we won't have to use those. Yeah, that's awesome. I think nail salons, dentists, other places are stepping up. Again, alcohol places are making hand sanitizer for people. Gracie, I don't remember the name of the website, but there's a COVID-19 Facebook resource that you can find out how to share stuff. And there's like a mask share program. Just Google mask share, exchange COVID-19 or something. I will put it on the bottom of this after I'm off of the podcast. But one thing I gotta focus on, and I need to tell for myself, for everybody, I think an important thing about this COVID-19 survival thing is not just surviving the disease, it's mentally surviving this. And what do I mean by that? We're all self-distancing and quarantining. I think we need to do better about taking care of our mental health. What does that mean? Number one, I would only watch an hour of news a day. An hour of news, because all COVID-19, it's all on a loop, and it's all kind of depressing. You're going to get the same stuff. Don't keep the TV on all day long, especially with the kids, especially whatever. 1 hour a day. Try to stay off social media. I mean, obviously, you're watching my podcast. I love that you are, but don't just be on Facebook all day long, because what are you going to see? You're just going to see COVID-19 stuff all day long. It's kind of depressing. So you need to take care of your mental health that way. Don't be shy about asking for help from friends. Set up little dinner dates, virtual, dinner dates on FaceTime or Skype if you don't have an iPhone, or go see a therapist on things. There's like headspace.com. I've heard is a good one, and they're offering free therapy for any healthcare worker. So if you're a healthcare worker, you can talk to a therapist. Now, I haven't done this yet. I'll be honest, this podcast is a little bit of my therapy, and it helps me unload a little bit. So I love doing these when I need to, do something for yourself. A great suggestion, and this sounds really stupid, but if you charge your phone, and everyone charges their phone when they sleep, don't put it next to you. When you charge your phone, put it outside your bedroom. Put it in your living room or in a bathroom or very far away, at least more than arm's length. Because what are all of you doing? I know what you're doing. You're waking up because you can't sleep, and then you stare into your phone for another hour, then you try to go to sleep for another 3 hours, you wake up and you stare at the phone again at all awful news, and you keep doing that, and you sleep crappy, and you don't feel well. So this sounds like a weird suggestion, but I think it will help all you sleep well, besides getting, face masks and and taking care of your health. Take your phone out of your bedroom. Do not charge your phone or have it within arm's length of you when you sleep while you're self-quarantining. Everyone, that includes your kids. Obviously, they shouldn't have their phones when they're asleep, I think. Ideally, you're managing your kids' expectation and anxiety with this. I don't have kids, but I think that would be very important because this is a strange new world. So that's all of it. Start a new hobby. Be inspired to cook and do other things. Again, I'm getting into cooking and telemedicine. So I think that those are all good things. And with that, I think I'm going to end because this is an 80-minute podcast. I forgot today. I was supposed to radio record it, but I will start actually putting this on podcast channels. Again, other resources besides the Facebook one, Medscape news update. Medscape.com has a great news update for Daily Mail. There's another one, that chart for the states. 91-divoc.com/pages/COVID-visualization. Again, I'll put the link up. That's the best one to look at the states, state by state. How is yours doing? Again, 91-divoc.com/pages/COVID-visualization. It's spelled like this, okay? That's the one you want to get to, okay? So again, with that, I'm going to add on, again, I am the Traveling Doctor. You can follow me. Again, Facebook is the Traveling DR, or just look for the Traveling Doctor. Instagram at the Traveling_MD, and Twitter at the Traveling DR. And I will eventually get on Radio Public. You can look for the Traveling Doctor. But again, I'll put most of my podcasts up here. So thank you for joining me. Again, I will try to update a little bit more. I have a couple of days off unless I get called in on emergency. So I'll be doing this a little bit more frequently, definitely by Monday, okay? So stay healthy, wash your damn hands again, and I will update you more later. Thank you for checking in. This is a public podcast. Share to your friends and your family. This is the Traveling Doctor saying peace out and aloha.